Well, hello. How are you
How,
doing?
well, the question is, how are you doing?
Oh, no, you first. I'm always the second of everything. So,
I'm doing well. Now, the surgery just was about a month ago. This visit is usually to show you the hardware, what we did, position of everything, making sure everything is all right. It would be unusual if everything is 100% at this point. I know that's not what I'm expecting, but let's talk about your back pain. How bad was your back pain before the surgery? 1 to
uh,
10?
well, I would say it was probably a 6, 7,
How
and
bad is it now?
I would say it's very dull, a 1, 2.
1, 2. So that is actually above what I expect. Usually I expect the back pain coming down 1 or 2 points after 1 month. So you're good there. What about
Yes.
the leg pain? How bad was the leg pain before? How bad is the leg pain now?
Well, I would say for the most part, the leg pain was up in the upper buttocks primarily with a little bit of radiation in the hamstrings and the
1
quads.
to 10. How bad?
Um, it it would that's where it would hit the 6, 7, and then if I overworked it or bent over too much, it would spike up to a 10 very
How is it
easily.
now? So it was
Uh,
7 to 10. And how is it now?
my leg pain right now, I virtually have no leg pain. So
So
I'm gonna let's be safe and we'll say 1, 2 also. I
1,
don't
2.
feel I don't feel any discomfort. The only thing I'm dealing with is still a little bit probably of nerve root irritation in my left foot, but
We will
it's
come back
nothing.
to that in 1 second. We will come
Okay.
back to that in 1 second.
Okay.
Now, did you, before the surgery, did you have problem on both sides or just was one side?
It actually it was kind of weird. It started primarily on my right side and then
Mhm.
migrated to really it was both sides. And near my surgery date, it was probably a little bit worse on my left side.
Okay, so how is it now? Mostly
Uh,
left?
yeah, just in the left foot. Otherwise, my
L5.
buttocks area, and that's good.
Left L5 numbness. Behind me is the Nick, my assistant that documenting things we talk about. Now, this in average is above what I expect after the surgery like that 1 month later. Let's look at the inside of you, okay?
Okay.
This is your back. This is Charles Slusher. It's from 17th May of 2021. And here it is. This is the side view, front view, down view. Let's go top to bottom. The top screws are perfect. The spacer is good. The second screws, you see them perfect.
Yep.
The spacer is perfect. The third screws from top are perfect. And the spacer is good. And the bottom screws, everything is exactly where it needs to be, doing exactly what it needs to do. Nothing is shifted, moved around. The hole where the nerves are going out, they're all open on both sides, nothing pushing on any of the nerves. Certainly, I had to push the nerve to the side at the time of the surgery. So your mild nerve root irritation is absolutely expected. We talked about that. It has a very good prognosis. Usually it gets better 4 to 8 weeks after the surgery. So it's going to start getting better. But sometimes before it starts getting better, people tell me they have like a jolt going down to the top of the foot for a few seconds and then goes away. Saying that when you sleep on your arm and when you wake up and then first it's completely numb, but then you shake it and then you feel have some zaps before it's normal again. That's how nerves heal. It's a good sign. That means the nerve is absolutely all right. It just have to wake up. So
Gotcha.
everything is perfect. Look at the distance between the disc base. This is the normal disc. This here and here, the bone was on the bone. And now look how they are separated. So, and that sort of opens up the space. Practically, not only that opens up the space, but you should be a good part of 1.5 inch taller now because I really jacked it up.
I try to measure myself, and I don't look taller.
Well,
I knew
your
you
spine
couldn't
is taller.
I knew you couldn't do anything about my looks, but I was hoping for height.
Now, literally in that area that we did, you're about 1 inch taller or more, okay?
Okay. Okay.
That's not why we did the surgery, but that's the side effect of what we did. Now, at this point, usually I send the patient to physical therapy
Okay.
to teach them what to do, what not to do, how to do certain things in a more suitable situation and activities to the spine. And I see the patient usually about 4 or 5 months after this to get another CAT scan, see the bone is growing before I tell you go do trampoline or motorcycling or things of that nature. So still be careful with those activities. How are your daily activities so far?
I would say they're good. Like I told Christine, I can tell, I think I'm getting better because I'm starting to get antsy to do more activities. So I'm glad we're thinking about physical therapy, because I was going to ask, about spinning or stationary bike or light
Yeah.
weightlifting, as far as like maybe bench press, where I'm at
Do me a
least.
favor, hold
Yes.
off on that,
Okay.
all of that until you see the physical therapy, show them what you want to do, and they tell you if it's a good thing or not, or if it's a
Okay.
good how to do it best, okay?
Okay. Perfect.
How long before the surgery did you have this pain?
Oh, I was probably dealing it for 13, 14 months.
Okay, you remember that I was hesitating a little because of your situation and your symptoms and the result of the discogram. I'm happy you convinced me to do it for you.
Yeah. Yeah. It was one of those things. What do we do next? But something had to be done.
Yeah, and I'm happy you convinced me, because I was a little concerned about the result of the discogram, that it wasn't as clear cut as you remember our conversation?
Yeah, because the discogram wanted to do that L2, L3 area seemed to be where the pain was, right? And we didn't get a whole lot of reaction lower.
Yeah.
But after you talking with the clinical symptoms that we had,
Yes.
so I think we came to a good conclusion. And I think
Yeah.
that was both of us talking about it and
Yeah.
seeing what was best to do.
There were usually, not most of the time, not usually, but most of the time, the clinical symptoms and the pictures speak the same language, to point toward in the same direction. In your case, they weren't. And in our policies, always fix the patient, not the film. So we decided to fix where the most of the clinical symptoms are, not where most of the films are saying what the problem is. And I think we made a good decision together. The fact that you are ahead of the curve, your symptoms are right now much better than I expect 1 month after this surgery. And this is a big surgery. So I'm happy, that we did those levels, and your persistence paid off.
Yeah,
Okay.
definitely. I think so too. I'm real happy so far.
Why did you fly all the way from Utah to us? Why couldn't you get it done in Utah?
I'll be honest with you. When I first went in to see a neurosurgeon that originally did my cyst removal back probably about 6 years ago, he actually came up, and when he seen my first MRI, he said, "Nope, we got to fuse it all." And he was really abrupt. And at that time, I kind of went into that, oh, we're just going to fix another cyst and everything's going to be good. So it kind of took me back, and I was a little not ready to make that type of a decision.
I see.
I did hear about you through a brother-in-law, his Gary Kunick, that also was seeing you up there. Did a bunch of research on you and your process and procedures, and that clicked with me. The first few, we were talking maybe about microdiscectomy. Maybe it wasn't quite as big as what we thought it would be. And then as we kept reviewing down the line and the discogram and that, we also came to the conclusion that fusion was probably the only way we were going to kind of relieve the symptoms that we had.
At least permanently, yeah.
Yeah. And I liked your approach to the fusion process from what I knew about it. With a lot of your discussions, I've got a lot of physical therapists I play hockey with, and everything that you had told me was exactly on point with what they believed in and what they thought your results were, your conclusions were. So that gave me a ton of confidence in you as the surgeon and what you did up there.
Thank you. I appreciate that.
And so that's when it was just, let's do it.
As well, I appreciate you doing your homework, because an educated patient is the easiest patient to deal with. When, if you know what the options are, you're doing my job. I have less job to explain them to you, make you understand that. But as well, you get a more realistic kind of expectation once you are aware of the options and so on. So thank you for helping me to make this process easier. Now, we are not done. We have we are just 1 month after the surgery. We have a long way to go for the bone to grow. Bone never grows back in 1 month, but your body will tell you what to do and what not to do. We just will help you to learn how to do certain things in a little different way to reduce the stress on your spine. If anything different, you call me and I see you sooner, but otherwise I see you in about 4 months or 4 to 5 months with another CT to look inside. I'm hoping at that time the bone is growing and we are done for most of the limitation. After open surgery, it takes you usually 9 to 12 months for the bone to grow. After my surgery, I see fusion after 4 months, so that is why I want to see you then.
Okay.
If anything else, you just give me a call. Otherwise, you just stay in contact with my office, okay?
Okay. One question for you. I've been
Yes.
using the spine stimulator. I've been doing really good with about, I actually do 2 sessions a day, so I have it on for 4 hours a day. Is
We're
that
talking
good?
about the bone growth stimulation device.
Yes.
Not
Yes.
spinal stimulation device. So that is supposed to give some electromagnetic waves that your bone cell understand it and it make them grow faster and stronger. It's about having that on for 4 hours a day. And the device is used usually up to 9 months, but most of the action happens in the first 6 months.
Okay.
And just whenever you're sitting around and doing nothing else, just put it on.
Okay. Because yeah, it's easy when I'm working. I just put it on and just let it go. So I mean, works perfect that way.
It works. It works.
Okay. Perfect. No, otherwise I'm good.
Okay.
And it sounds like you put an order in to start some physical therapy, and Christine.
Yeah, I will.
Okay, perfect. Then I think
Have a
we're all
day,
good.
okay?
All right, you too.
Bye-bye.
All right. Bye-bye.